this had increased in occurrence. And we believe that is because there are some horses who start with their head above a vertical position, and when their pain is resolved, their head drops behind a vertical position. We compared threshold values of 6, 7, 8, and 9 out of 24 and found that a cutoff value, a threshold of 8 out of 24 gave us the highest combined sensitivity and specificity. So further validation that the threshold of 8 out of 24 is valid. In this next study, the Ridden Horse pain ethogram was applied to 150 horses examined consecutively for investigation of lameness or poor performance, all of whom were evaluated ridden. The Ridden Horse pain ethogram was applied before diagnostic anesthesia and after diagnostic anesthesia with or without a change of saddle if the saddle was thought to be contributing to underlying discomfort. In red, we see the Ridden Horse pain ethogram scores before diagnostic anesthesia, and in the magenta, we see after diagnostic anesthesia. And we can see that there are significant, substantial reductions in the Ridden Horse pain ethogram scores. There were a few outliers in which the Ridden Horse pain ethogram scores remained high. These were horses which had lameness associated with caudal neck problems with suspected cervical radiculopathy. If we look at the 24 behaviours before and after diagnostic anesthesia, with or without changing the saddle, we can see the frequency of occurrence of each of the behaviours before diagnostic anesthesia in the white bars, and in the blue bars we see after diagnostic anesthesia, with or without a change of the saddle. And we can see that some behaviours were completely abolished, such as a gait which was too slow, sudden changes of direction, kicking or bucking, and rearing. Many of the other behaviours were substantially reduced in frequency. If we look at head behind the vertical, in this study, a much larger study than the previous study, we saw that there was indeed a reduction in the frequency of occurrence of head behind the vertical. But it was not reduced as much as other behaviours. And this was because a proportion of the horses that had their head above the vertical pre-diagnostic anesthesia, then had their head behind the vertical after diagnostic anesthesia. 21% of 62 horses which had their head above the vertical for 10 seconds or more before diagnostic anesthesia finished up with their head behind the vertical for more than 10 seconds after diagnostic anesthesia. So let's look at a clinical example. This is an intermediate event horse. We can see repeated tail swishing. The horse's head is moving up and down constantly. The rider's hands are moving, but that in part reflects her instability, and she is not inducing the horse's head movement. We saw the horse break spontaneously from trot to canter. The bit is being pulled through to the left-hand side of the horse's mouth. The tail is crooked. Again, breaking spontaneously from trot to canter. Repeated up and down movements of the head,